Hello, now you are watching CafeWeb TV. In modern-day lifestyle, caring about your mental health is an important key to find a balance in your daily life and activities. If you're facing a mental health problem, unfortunately you might experience lack of motivation, hope, and also you may encounter with decentralization, impatience, and chaos. Although we have plenty of disorders that are recognizable and many of us have knowledge about them, but today we want to talk about ADHD. What is ADHD? Attention Deficit Hyperactivity Disorder or ADHD is a condition that affects people's behavior. People with ADHD can seem restless, may have trouble concentrating, and may act on impulse. ADHD is a neurological disorder that impacts the parts of the brain that help us plan, focus on, and execute tasks. ADHD symptoms vary by subtype: inattentive, hyperactive, or combined, and are often more difficult to diagnose in girls and adults. Many people experience inattention and changes in energy levels. For a person with ADHD, this happens more often and to a greater extent compared with people who do not have the condition. It can have a significant effect on their studies, work, relationships, and home life. Both adults and children can have ADHD. What is the reason behind ADHD? Despite how common ADHD is, doctors and researchers still are not sure what causes the condition. It's believed to have neurological origins. Genetics may also play a role. Dopamine. Reduction in dopamine is a factor in ADHD. Dopamine is a chemical in the brain that helps move signals from one nerve to another. It plays a role in triggering emotional responses and movements. Other sources suggest a structural difference in the brain. Findings indicate that people with ADHD have less gray matter volume. Gray matter includes the brain areas that help with speech, self-control, decision-making, muscle control. Researchers are still studying potential causes of ADHD, such as smoking during pregnancy. Research to date has shown ADHD may be caused by a number of things: brain anatomy and function. A lower level of activity in the parts of the brain that control attention and activity level may be associated with ADHD. Genes and heredity. ADHD frequently runs in families. A child with ADHD has a 1 in 4 chance of having a parent with ADHD. It's also likely that another close family member, such as a sibling, will also have ADHD. Sometimes ADHD is diagnosed in a parent at the same time it is diagnosed in the child. See inheriting mental disorders. Significant head injuries may cause ADHD in some cases. Prematurity increases the risk of developing ADHD. Prenatal exposures, such as alcohol or nicotine from smoking, increase the risk of developing ADHD. ADHD symptoms. What are the signs of being ADHD? Common ADHD symptoms include inattention, poor time management, weak impulse control, exaggerated emotions, hyperfocus, hyperactivity, executive dysfunction, having trouble focusing or concentrating on tasks, being forgetful about completing tasks, being easily distracted, having difficulty sitting still, interrupting people while they are talking. Signs and symptoms can be specific to different aspects of ADHD, such as hyperactivity, impulsivity, or difficulty focusing. A person who is experiencing hyperactivity and impulsivity may find it difficult to sit still or remain seated in class, have trouble playing or carrying out tasks quietly, talk excessively, find it hard to wait their turn, interrupt others when they are speaking, playing, or carrying out a task. Someone who is having difficulty focusing might make frequent mistakes or miss details when studying or working, find it hard to maintain focus when listening, reading, or holding a conversation, have trouble organizing their daily tasks, lose items frequently, be easily distracted by small things happening around them. Types of ADHD. To make ADHD diagnosis more consistent, the American Psychological Association has grouped the condition into 3 categories or types. These types are predominantly inattentive, predominantly hyperactivity impulsive, and a combination of both. Predominantly inattentive. As the name suggests, people with this type of ADHD have extreme difficulty focusing, finishing tasks, and following instructions. Experts also think that many children with the inattentive type of ADHD may not receive a proper diagnosis because they don't tend to disrupt the classroom, and this is more common among girls with ADHD. Predominantly hyperactive impulsive type. People with this type of ADHD primarily show hyperactive and impulsive behavior. This can include fidgeting, interrupting people while they are talking, not being able to wait their turn. Although inattention is less of a concern with this type of ADHD, people with predominantly hyperactive impulsive ADHD may still find it difficult to focus on tasks. Combined hyperactive impulsive and inattentive type. This is the most common type of ADHD. People with this combined type of ADHD display both inattentive and hyperactive symptoms. These include an inability to pay attention, a tendency toward impulsiveness, and above-average levels of activity and energy. The type of ADHD you or your child has will determine the treatment method. The ADHD type you have can change over time, so your treatment may change, too. ADHD treatment. Treatment for ADHD typically includes behavioral therapies, medication, or both. Types of therapy include psychotherapy or talk therapy. With talk therapy, you or your child will discuss how ADHD affects your life and ways to help you manage it. Another therapy type is behavioral therapy. This therapy can help you or your child learn how to monitor and manage your behavior. Medication can also be very helpful when you're living with ADHD. ADHD medications are designed to affect brain chemicals in a way that enables you to better manage your impulses and actions. ADHD medication. For children aged 6 and over or adults, medication may be an important part of the treatment plan. Finding the right medication to manage ADHD typically involves some trial and error but can lead to a significant reduction in symptoms. The two main types of medication used to treat ADHD are stimulants and non-stimulants. Central nervous system CNS stimulants, like Ritalin or Adderall, are the most prescribed ADHD medications. These ADHD medications work by increasing the amounts of the chemicals dopamine and norepinephrine in the brain, which help with focus. There are 3 categories of stimulant medications: short-acting taken a few times a day, intermediate-acting taken less often, long-acting taken 1 a day. If stimulants cause problematic side effects or simply are not effective, your doctor may suggest trying a non-stimulant medication, like Strattera. Non-stimulant ADHD medications are considered second-line or third-line treatments because the level of benefits and response rates are significantly lower. Meaning, stimulant medications are more effective at relieving symptoms for a larger percentage of people. ADHD medications can have many benefits as well as side effects. The decision to manage ADHD symptoms with medication can be a difficult one. Learn more about the risks and benefits of stimulants and non-stimulants, medication options, how to gauge effectiveness, and more. Tips for coping with ADHD. If you or your child has ADHD, a consistent structured schedule and regular expectations may be helpful. For adults, staying organized can be helpful. Here are some ways that can help with getting organized and maintaining it. Making lists. Keeping a calendar. Setting reminders. For children, it can be helpful to focus on writing down homework assignments and keeping everyday items like toys and backpacks in assigned spots. And for children and adults, untreated ADHD can have a lasting effect on your life. It can affect school, work, and relationships. Treatment is important and can help lessen the effects of the condition. Many people with ADHD enjoy fulfilling and successful lives. Some even express appreciation for the benefits of the condition. If you think you or your child may have ADHD, an important first step is talking with a doctor or another healthcare professional as soon as possible. They can help determine if ADHD is a factor for you or your child. If you or your child receives a confirmed ADHD diagnosis, the doctor can also help you create a treatment plan to help you manage your symptoms and live well with ADHD. Don't worry, you can do it. If you are facing mental health problems and need to learn more about them, follow us on CafeWeb TV. Thank you for your support.